Good afternoon. My name is Linda Flowers, and I'm the president of the Carbondale branch NAACP. Welcome to our virtual team chat on coronavirus, and thanks to all of you for spending your time with us this afternoon. A special thanks to our presenters and Dr. Ella Lacey and Sierra Allen of the Carbondale Branch NAACP for organizing this afternoon's event, and Jennifer Robertson of the Carbondale Public Library. The Jackson County Health Department has recently issued a public health alert to address the increase in COVID-19 cases among young adults. So, let's all listen to and take heed to this very important information presented this afternoon. We're going to start by introducing the health chair for the Carbondale branch NAACP, Dr. Ella Lacey.
Thank you. Thank you very much for that. Good afternoon. Just 1 second, please. A technical difficulty, I guess. Okay. Good afternoon, everyone. I am sorry that something happened to my visual part. However, I understand you can hear me okay. Even though we're not here for happy news as such, the information that we will be dealing with is not exactly happy. But we are so happy that you have decided to share an hour of your day thinking about and learning about coronavirus. Our format for today is to have the three presenters make their presentations. If you have a question forming in your mind, it is best to wait until the presenter is finished. Then send your questions to us by way of the Q&A. If you use the Q&A to ask questions of the presenters, that would be the very best thing to do. Then when you want to tell us something about your name and answer to a question related to the door prize, if you were to send that through the chat, that would help us to keep up with things better. But you really may use either Q&A or chat because sometimes they're not both available. So we're very fortunate that the NAACP has been able to supply some door prizes as a token of our appreciation. And each will be based on a question that Sierra Allen will present to you. And we ask you then to send the answer through with your name so that we can get the door prize to you later. And we know you will always have good and ready answers. So that takes care of our sort of housekeeping detail. Now I'd like to proceed with our presenters, thinking of our presenters and making sure you know who they are. I cannot see the slides, but I believe there is a slide on each of three presenters. Bart Hagston from the Jackson County Health Department. And there's information displayed on the slide. Bart is administrator at Jackson County Health Department. And I believe he's been with the health department some 13, 14 years. He has been in several positions, but probably has never been busier than he is now, making sure we know about the coronavirus or COVID-19 and that we are prepared to cope with it. Bart is a public health professional and is going to share facts and data with us, not just opinion. He's going to share facts and data. He is a public health professional. The second presenter is Kristen Matthews. Kristen has been with the health department only 1 year or so. And I'll bet you a couple of years ago, she could not imagine being quite as busy as she is at the present time. But we're so glad that she's there and that she can help us. Her role and title at the health department is health educator. But in times of crisis as this, she may be serving any number of other roles as well. And I'm sure she's doing an excellent job, whichever thing she's assigned to do. Our second presenter, Kristen will be the third presenter. Our second presenter is Fanta Saidou. Fanta is a doctoral candidate at SIU in SIU's public health program. She works with COVID data in the community, but she's here on this panel today as a graduate student from SIU. But since she works in the community, you may see her around from time to time. Be sure and say hello when you do, or wave lightly at her behind your mask. So anyway, that takes care of our three presenters who will come to you, with Bart Hagston being our first one.
Okay, thank you, Dr. Lacey, for the introduction. It may have just got dark in my office. Somebody flipped the light off, so I'll just keep talking. So I appreciate being asked to be on this panel today, and I appreciate sharing the spotlight today with Fanta and Kristen, both people I know and respect and who do great work. So I want to give them some props as well. So I was asked to speak today about our work that we've been undertaking here at the health department regarding COVID-19, which is the disease caused by the novel coronavirus, and to talk about some of the numbers there, and maybe I'll try and aim some messages right at the people that this webinar is aimed at, and that is young adults and teens. And so because we've got a lot to say to them about this disease and the efforts that they can undertake to help us get this pandemic under control. So thank you for inviting me and having me on this webinar today. I greatly appreciate it. So we've had cases in Jackson County since the third week of March was our first case in Jackson County. Through yesterday, we're up to 588 total cases that have been confirmed in Jackson County to date. In the month of July through yesterday, we had 258 of those cases. So over 40% of our cases just in July. So we had a very slow month of June, and we felt like we had a very good grip on this virus, and we've seen a big increase in the number of cases since the start of July. So that's very concerning to us, especially as schools are coming back in session. And one of the big reasons that we're really concerned is the spread of this virus amongst young people in our community. And so out of those cases in July, almost 70% of them have been from people in their teens, late teens and 20s. I think there's a couple reasons for that. So I think young people, they're social in nature. They want to hang out with their friends, which is what they do in normal times, and they're continuing to do it during our COVID times. And the other thing is young people typically aren't being as greatly impacted by this virus. So they're not coming down with a lot of symptoms like other people. And so that tends to, I think, have young people underplaying what this virus means and how harmful it can be. And so while young people may not come up with or have the more complicating factors, some of the worst symptoms, that doesn't mean they should not be concerned about the virus, because as the cycle of transmission is being driven by young people in our community, then it's going from young person to young person, and eventually then one of them will come into contact with their grandmother, their aunt who has a chronic health condition like diabetes or heart disease, or might have some immunosuppression issue. And so it's when it lands in the lap of somebody like that who is less able to handle the disease that it becomes problematic. And so so young people need to realize that as they become part of that cycle of transmission of the virus within the community, then that becomes a problem, because the disease continues to spread and spread, which is what is occurring now. Dr. Lacey or Linda mentioned the public health alert that we issued last weekend to really bring attention to the fact that young people are driving transmission of this virus in our community. Just at 12:30 today, the Illinois Department of Public Health issued this warning. 11 Illinois counties added to the COVID warning list. Jackson County is one of those counties. This will get a lot of media play today, as well it should. So what's really happening is local health, state health department are really trying to raise the red flag here about coronavirus and its transmission in our community, and trying to get people to pay attention, especially young people that are helping to spread this virus. So what we're asking young people to do is to step up and be good stewards for their community, to practice all of the things that public health has been talking about, including social distancing being the big one. Even more important than wearing a mask is maintaining your distance from other people, getting together with friends in small groups, but maintaining your distance. Masks are important as well. So wearing those in those situations when you cannot social distance. We're seeing lots of transmission of the virus from small parties that are going on in people's homes. We're seeing transmission from pool parties, people that are sharing vaping devices or vaping in small groups together. So these are all risky activities that young people are participating in, and we need them to curtail those activities, to be good role models for those that are younger than them. So if you're a teen, late teen, 20s, try and model behavior for others to follow, because that's what we really need right now, is people to lead by example and show others that wearing a mask isn't uncool, and that you can do it and still maintain your identity and be able to get together with friends, but do so in small groups and in socially distanced ways. So that's what we're here asking young people to do today, and what we'll continue to be doing until there are vaccines available for this virus, and we can switch gears to eradicating the virus versus just being able to mitigate or control the spread of the virus. So that's what I wanted to say today. I'm certainly happy to take anybody's questions, or however you want to handle that, Dr. Lacey.
We have asked the participants to please submit their questions. And one thing that might happen in the meantime is Sierra will offer a door prize. But we'll get all the questions, and then when the three presenters have finished, we're going to spend a little time with questions directly. Okay? All right, thank you. Okay, so our next presenter is Fanta, Saidou.
Thank you all for being here with us today. And thank you, Bart, for just providing us with that update on the current situation of things happening in our county. I believe I do have some slides for this presentation. Okay. So moving right along, I will be talking to you about the importance of not letting words and numbers about the coronavirus confuse you. Next slide, please. So while the virus is affecting us right here at home, just as Bart was just sharing with us in Jackson County and across other counties as well, it is also affecting others across the nation, across all states, as well as throughout the world. So this is an image just to show you that this virus is not just something that's here with us, but it's affecting everyone else as well. So the red spikes that you see there is just a microscopic structural view of what the virus looks like. So I'm sure you've probably come across some of those things. And so that's just what that is. There's so much more that goes into it, but you can research more about that if you would like. So next slide, please. So in looking at the current national status, so when we look at the United States as a whole, we can see that approximately 4.5 million cases of total cases is what we're experiencing right now. And this number is going up daily. So of those cases, we have approximately 150,000, over 150,000 deaths that occur. And this number as well is going up. So these are estimates that I've pulled as of yesterday. So I'm sure by now these numbers have changed. They get updated every 24 hours. So with the numbers that I've just shared, so to just kind of break it down for just the daily view, so it can be estimated to be about 65,000 new cases that we are seeing daily across the United States, as well as over 1,000 deaths each day. So with an increase in cases, we are hearing more about hospitalizations that are taking place for individuals who are experiencing a lot more cases that are more complicated as a result of the virus. So with that being said, you might ask yourself, why are these numbers increasing even though there is so much that's being done right now to fight against this virus? And it's been around for several months with us, so it's not something that just started yesterday. So with that in mind, I think it's safe to say that we are seeing just the lack of complete adherence to set preventative measures from public health and doctors and people that are working on combating this virus together. So these preventative measures are set in place to help slow the spread, as well as to protect people from being exposed as we're working towards a vaccine. So as you can see on this map in front of you, the states that are shaded the most red are the states that are experiencing more cases. So in leading of all the states, California is the number one, leading with the highest cases, followed by Florida, Texas, New York City, New York, and then New Jersey. And then we have here Georgia as well as Illinois. So the list goes on, but I just pulled these top 7 to show you because those are the states that are highlighted on this map. And this map is from the CDC. So the state of Georgia and Illinois they keep going back and forth. So they're pretty close to one another. Next slide, please. So when we look at across the world, we know the virus started in China, in Wuhan. And so since then, this map shows that it's traveled. Every other places in the world as well are experiencing complications and things from this virus. So just the quick numbers from just the world view. So total cases right now, including everywhere in the world, we are at more than 17 million cases. Total deaths were averaging almost 700,000 deaths all across the world. So with the top countries most affected, including the US being number one, so that's us, India, Brazil, and then South Africa. So next slide, please. Okay, so I like to call this slide our new COVID-19 vocabulary. So over the past several months, the coronavirus situation has most certainly introduced us to new words and phrases. So I'm sure a lot of these are words that you've probably come across or heard in the news or just social media in different places. So I think it's important that we take a moment to kind of understand what some of these words mean, because not only will they help protect you, but it will help you to be able to encourage and teach your friends as well and those that you love about the infection and just the virus in general, while also having a better understanding, we believe, will help with decreasing your own anxiety that may come from the situation, confusion, and even possible fear. So the coronavirus disease is what we probably most likely hear, and that gets shortened to COVID-19. So I think that might be the most common thing we actually hear, which the COVID is just the breakdown of the corona. Corona is the CO, and then the VI is the disease. The VI is the virus, and then D is the disease. And then where we get the 19 from is the 2019 year. So you've probably heard about the CDC in the news, and what this is, the CDC stands for is the Centers for Disease Control and Prevention. So it's our US federal health protection organization. So it's housed in the Department of Health and Human Services. And so this is a reputable website. If you are interested in learning more about the virus, we highly encourage that you visit the CDC, because it's everything they put on there you can trust, and that website is cdc.gov. So if you're looking to explore more about the virus, we highly encourage that you get your information from reputable websites such as the CDC. So you might have also heard of the World Health Organization, or WHO, in the news or even on social media, for example. So they as well are in this to monitor and they protect public health, but they go all around the world. So it's not just here in the US, it's all around the world. So that's what the World Health Organization does. So going down our list, we have pandemic. So we hear that word a lot during this time. And so just to define pandemic, it's defined as when a disease spreads across many countries around the world. So we're all experiencing this. It's not just Carbondale, surrounding counties, it's happening everywhere. So this is where it gets the pandemic comes in, because it's affecting countries all around the world. So then going down our list, we have immunocompromised. So Bart briefly touched on this earlier in his presentation. So what this word means is it's having a weakened system that can't resist or fight off certain infections that you may have, such as the virus, for example. So your body is not able to fight infections off as well as other people's bodies might be able to. So certain illnesses or conditions can bring this upon certain individuals. So while also certain types of treatments that you're going through is what can compromise your immune system. So we have spread, and so that spread can be defined as the virus moving around. So from one person to another to a different location, so it's spreading all over. So that's just what the spread means. And then looking down, we have outbreak. So an outbreak is defined as a sudden increase of cases in a specific area. And then we have close contact, which is a very important one in this case of COVID, where you're in close contact with someone if you are within 6 feet of an infected individual for at least 15 minutes. So that's what close contact means. And I think Kristen might touch on contact tracing, or, but that one is pretty much, that's a lot of what the health department is doing. And so it's based on looking at where you've been, who you've been in contact with, and just trying to get to know who all could potentially be affected so that they can be in contact with them. So then the symptoms, those are just what things that you might experience that indicates that, hey, you might have this virus, which, as we know, we talk a lot about possible fever, might have a cough or shortness of breath or headache. And the three I previously mentioned are the main ones that you may experience. So with symptoms, then we look at here, the slide shows screening. So with screening is done to determine if you need a test. So this is done through a series of questions about your current health condition, or it could be assessing a recent history and by the individual that's assessing you. So should you need a test, that's when you do get the test, and that's a swab test usually. It's usually done through your nose. And there are designated testing stations for that. Could be a drive-through format, and I've also seen different tents outside set up where you come by and you get your tests there. And this is usually after you've called in and you've been told, I think you should get a test. It's based on referrals. So then our next word is quarantine. So this is defined as separating a person or a group of people reasonably believed to have been exposed to the disease. So this doesn't necessarily mean that you're showing symptoms yet, but there's a possibility that you may be infected. So it's separating you from other people so that we can eliminate the spread, hopefully, or at least reduce it. Down our list, the next thing we have self-isolation. So it's important to understand what this means. So you choose, oftentimes people will do this if they've traveled maybe out of the state, coming back in, and they just take 2 weeks, so 14 days to just monitor their health and just to see where they're at. And in some cases, when there's been a confirmed case, you may be asked to, well, you can either choose voluntarily to self-isolate yourself, or you may be compelled by your local health department or state or federal even to self-isolate yourself. So the self-monitoring touches back in with the self-isolation, which this is when you're just simply checking yourself for symptoms. So you may have also heard of a word called asymptomatic. So what this really only means is that you're not showing any symptoms. So you don't have signs of the illness or the disease. Even with that being said, doesn't mean you don't have it. You're just not showing signs, but you are still contagious. So you can definitely spread it to other people. And so the opposite of that would be symptomatic, where you are showing symptoms. So social distancing, this is a big one that we're constantly hearing and we're highly encouraging during this time. So it's putting actual physical distance between you and somebody else. As Bart talked about, avoid crowds, avoid groups of people, maintain your 6 feet distance, or you can even do 8 feet. So at least 6 feet or more apart from other people. So then we have PPE, which I'm sure you've probably heard about that in the news, which just stands for your personal protective equipment. So these entail our masks that we're using during this time, any type of face shield or gloves, gowns, things used in the hospitals to protect individuals. And so all of that falls into this category. So protective equipment for us is to use our masks when we're out, socially distanced, using your mask. So that's the best way to attack this virus right now. So then we have prevention. This is a word that it's taking action to stopping something from happening or maybe getting worse. So Next slide, please. So on this slide, it actually shows us 3 things that we can do. So this is what we can do to put prevention into practice by not only knowing, but also acting. So knowledge and understanding without action is oftentimes not helpful. So we encourage you all to do your part as we're doing our parts. This is a whole community thing. We all have to come together and do our part. So if you're leaving home, we highly encourage you to remember your 3 W's, which are, first thing, wear your mask. Second thing is to wait, so this is the social distancing part where you're 6 feet apart, and then to constantly wash your hands. Next slide, please. So just to close, I do want to encourage everyone that we are in this together. And that's the best way to respond to this time, this hard situation that we're in. We are truly in it together. When we all do our part individually, we are not only doing what is right, but we are caring for each other, we are loving each other, as well as we are taking care of each other. So let's all do our part and fight this virus together. So thank you.
Thank you so much, Fanta. Thank you. That was very helpful. Our third presenter is Kristen Matthews. Kristen?
Good afternoon, everyone. I am Kristen Matthews. As Dr. Lacey stated earlier, I am a health educator here at the Jackson County Health Department. And currently, as a part of the COVID-19 response, I am also a contact tracer. So as Fanta mentioned within her presentation, I am one of the 11 people here that are notifying the positive individuals in our community and just trying to make sure that they are isolating, that we get in contact with their close contacts and keeping them home so we can get everyone back to normal as soon as we can and in the best health possible. So I am delighted to be here to speak with you all. I would like to thank the NAACP as well as Dr. Lacey in particular for the invitation. So to keep it very simple, 2020 altogether has been quite the experience, if I should say so myself. I won't begin to name a lot of the events that have taken place within the first 6, 7, going on 8 months, but it has been a journey simply because of the obvious coronavirus disease. And just thinking of COVID, coronavirus, the first word that comes to mind is change. COVID has, if you think about it, COVID has changed the whole world, if you think about it. But just thinking on a smaller scale, locally, it's changed how we interact with our friends, our family, individuals in the community. And especially for students, you guys went on spring break and that was kind of it. Like there were no more pep rallies. There were no more of those fun end of the year events to close out the year. And on top of that, the next school year is going to be completely different than what just closed. So thinking of this new normal and all of the uncertainty moving forward throughout this pandemic, I just want to emphasize that it is okay for our thoughts and our feelings and our emotions to change. With a lot of change and uncertainty, it's okay for us to be anxious. It's okay for us to be a little more nervous than usual. We might be a little more on edge. We might get frustrated easily. We might be more paranoid with how we are, how clean we are, how close we are to people. So I know firsthand how easy it is to feel helpless through this situation, and it's been going on for so long, and you might be at a point where you don't even see the tunnel to see the end, to see the light at the end of it. So I just wanted to share some tips with you all on how you can cope throughout all of this. And as I was writing this up and thinking of things to say to you all, I was helping myself along the way. So I do hope this is helpful for you all as well. So the first thing that I want to share is that we need to focus on what we can control. We do cause a lot of extra worry and anxiety because we let the things that we cannot control outweigh what we can control. So thinking about what we can control during this time, we can wash our hands, remind other people to wash their hands, social distance. If you see somebody too close to you, don't be afraid to tell them to, excuse me, you're in my personal space here, doing what's best for the both of you. Wear your mask, and not only wear your mask, wear it correctly over the nose and the mouth, not just the mouth, not on your chin. So wear it correctly. As you are protecting yourself and controlling the ways that you're protecting yourself, you are actually helping to protect others as well. So just keep that in mind. So to stay in the present is the second thing that you can do to cope. If things begin to feel like they're out of your control, and we have the tendency to create different scenarios that might not even happen in the future, just bring yourself back into the moment. Think about what's around you, what you can see, what you can feel. If you're eating something, what you can taste. All those sensory experiences, and remind yourself that at that present moment, you are here, you are alive, you are doing as well as you possibly can at the present moment, and you are doing your best, as we all are doing our best to get through this. The third thing I want to share is to practice self-care. So take a walk, meditate, read a good book. Make sure you're eating well and sleeping well. And of course, self-care looks different for everyone. I know for myself, I have not been watching the news. I can't bear it, hearing it every day, working in it, and then going home to watch the news. I know that's not what's best for me. So you know what's best for you. Do those activities, relax, and do what you enjoy the most that will bring you the most peace. The fourth thing that I would like to share is to just make sure you're staying connected with others, maintaining those positive connections, keeping in touch with your classmates, different family members, as well as your elderly neighbors and your elderly relatives. Just check on people and see how they're doing. There are many people who really are struggling, dealing with this, and just one contact, just somebody asking them how they're doing could change their whole day and change their mood and their outlook on things. So, and if they do ask you how you're doing in response, just to make sure you're being honest with how you're feeling. Don't be afraid to let people know if you might be struggling, if you might be feeling lonely. You only get help if you ask for it. So, which leads me to my last point, is to reach out if you do need more support. Like I said, there is nothing wrong with needing a little extra help, letting people know that you might be in a rough place. There's no need to feel ashamed. And like I said, you can only resolve something if you admit that there is a problem in the first place. And I do have a slide with resources that I would like to share. So the CCHS students are actually very fortunate to have Terrier Care. Not only can Terrier Care provide medical services on campus, but you all do have a counselor there as well. So once school gets started back up, however that looks, if you feel like you need that care, get in contact with Terrier Care and they'll get you connected with the counselor that they have there. I also have here the crisis text line. You can text TALK to 741-741, and a professional will be able to get in contact with you and just talk you through what you're feeling. I also have here the National Suicide Prevention Lifeline that you can share with individuals as well. at 1-800-273-TALK. And also the Behavioral Health Action Team maintains a mental health resource guide. And I have the link here in the slide, and it has resources for the lower 16 counties in Illinois. And of course, Jackson County resources will be available that you and your parents can look over and find you the most appropriate help that you might need. So in closing, I just want all of you all to remember that you are not alone in this. We are taking it day by day, trying to get through this. We are resilient. We are more resilient than we think. We are going to bounce back and be better from this. And we will get through this. So keep your head up, guys. And thank you for the opportunity to speak.
Thank you so much, Kristen. That was wonderful. Well, we've heard from our three presenters, and each was different enough that I think we all got something from each that we can take with us. Now, there are two things we need to do now. One is give Sierra an opportunity to announce a door prize. And the second one is for the panelists, before she gets the questions to us, for us to review. For the three panelists, we can review together whether there's any one thing, as you heard other panelists presenting, is there any one thing you wanted to add in? So think about that a moment while Sierra does a door prize. Sierra?
Okay. Hello, everyone. My name is Sierra Allen. I wear many hats in the Carbondale community, but today of the NAACP member who is here to kick off the door prizes. So I want to give the first door prize to Ann Downey for logging in first. You'll receive a $15 McAllen kit. You can leave your address or email address in, I want to say maybe the chat, or not the chat.
The chat.
Yeah, the chat. Okay, so we'll do the chat. So if you can leave your email address or address in the chat, and we'll reach out to you and make sure you get your certificate.
Great. Okay, thank you much. Bart, Fanta, and Kristen, do you have any one thing that you'd like to add into, or just to sort of summarize, or anything, any one thing that you might want to say to the audience?
Well, I'll start there, Dr. Lacey. And so the one thing that I would like to say is how much I appreciate the information that Fanta provided from a global perspective. I think that's very important to keep in mind, as well as breaking down a lot of those terms that we at Public Health keep rattling off to people, and we may forget at times that everybody doesn't speak our language. So I appreciate her interpreting a lot of that for the masses. And the message that Kristen brought forward about taking care of our mental health is very important. As people have been isolated, that takes a toll on people. And so this is a public health crisis, and it's not just one related to the spread of this virus, but also one that impacts people in lots of ways, including mental health, but also people preventing them from getting health care. They don't want to go to the hospital or the doctor because they're scared, or because services have shut down. And so I think we're going to see a lasting impact from this virus on other health issues that people face. So they may have stopped their cancer treatments, for example. And so I know people in that boat. And so this virus is going to have many rippling effects throughout our society and our economy. And we need to be cognizant of that fact. The other thing I would like to encourage people to do is just to be kind to people. We're all on different paths here, different journeys, and dealing with this in different ways. And we all have good days and bad, and just extending a little bit of kindness to those around you can go a long way. And so that would be the one thing that I would really like to leave with people, is just to to lead with your heart and to be kind to people.
Thank you, Bart. Fanta, you have anything?
Yeah, I just want to encourage to like everyone, like great job with what you are doing, you know, and we are in this together and we're figuring things out as we go. So as Bart said, you know, be kind and to others, but that also includes being kind to yourself, you know, so it's be kind to yourself and those around you and keep going, do your part. And I encourage you in that.
Okay. Thank you so much. Kristen?
Well, to re-emphasize what Bart and Fanta have both said, just continue to do your best to stay safe, social distance, wear your mask correctly. Just make sure, especially being kind to others during this time, maintaining those connections. There are still ways to be connected without being face to face. But even if you do have to be face to face, just be mindful of the safety aspect of that and just take care of yourself and be kind to yourself.
Okay. Thank you so much. Sierra, we will let you once again. I don't know if you want to quickly give a door prize or you want to go to the question.
Okay, we could go to the questions.
Okay, that's great.
I have a question from Facebook from Diane. This is for any of the panelists can answer. She says she works with volunteers that are 55 and older, and they're afraid to leave their homes, and also they care very little about masks or other recommendations. How can she? What's the best way to get them to calmly participate in the recommendations from the CDC?
I'm sorry, Sierra, can you say that one more time? My audio cut out there, it seemed like.
Okay, basically Diane wants to know how she can get the elderly volunteers that she works with, how can she get them to take the CDC recommendations seriously?
Well, certainly seniors are one of those groups of people that are more at risk for catching COVID and from suffering worse impacts from it. And so the data has shown that elderly populations are adversely affected by this disease. And so I think, you know, that should really speak to some of our seniors that that they should be taking the precautions. And, you know, the ones that I have talked to have certainly been heeding that advice and taking this disease seriously. And so I think, you know, the data speaks for itself and helps to drive that point home.
Sarah, if I could add a little bit to that, being one who is both in that age group, that vulnerable age group, as well as one who works with who is a volunteer and works with other volunteers, Diane may want to see what things she can think of. I don't know what area she's working in, but if there are any ways that you can let those people who are 55 and over do some work from their homes, whether that's just as we're doing here on the computer, where you use Zoom for various things, or they get packages together, set them on their doorstep, and someone picks them up. But we have to restructure our way of doing things. And I say that largely because I've been with an after-school reading program for years. And, you know, we work with children kindergarten through 5th grade. And that really, you almost can't envision reading without being there with them, listening at them, putting your arm around them as they're reading or whatever. But we have to think of different ways to do it. So that may help some with getting the volunteers engaged. And it may not be that they're so afraid to leave their homes, as it is defined as something it's not smart to do by the CDC. They tell us we're vulnerable and we should stay in longer than other people are staying in. Okay, thanks so much, Sierra. Take it back.
Okay, the next question we have is from the Q&A. Benji wants to know, is there a cost for people to get checked for COVID-19?
So under the Federal CARES Act, which was passed this spring by Congress, that there is no cost for getting a coronavirus test. Now, if there are other associated tests that somebody gets alongside it, like a flu swab or a respiratory panel done, then there would be costs associated with that. I've also seen some scattered media reports about providers that are possibly not following the CARES Act and maybe doing some balance billing for tests when they occur, but that's that shouldn't be the case, and so people should be not getting billed directly. You should be presenting your insurance card, but not be getting a balance bill from the provider for the test.
Great. Okay, did anyone else want to add to that question, or can we move on to the next one? So Anthony wanted to know, do you think that we should enforce harder punishment for people walking in public places without masks?
Sorry, Sierra, you cut out a little bit. Could you repeat that, please?
Sure. Anthony in the chat wanted to know, do you think that we should enforce harder punishment for people walking and working in public places without masks?
Well, how I would answer that is we should be following the guidelines. So for individuals, if you're working somewhere around other people where even if you can maintain, the 6 feet, you should still, if you're indoors, you should still wear your mask. That's my answer to that, where doing all these three things, the 3 W's we talked about in this presentation, are very important. And so that's how we can start to see cases go down and things to flatten once everyone can do that collectively and do it well. So I would say, yeah, there should be more enforcement. We should be enforcing these things. And as far as punishment, I think we should encourage people to do it. And maybe organizations or wherever the person's going into can say, well, if you don't have a mask on, I'm sorry, you can't come in, and kind of enforcing that and making sure that people aren't just once they're in taking it off. So having people that are looking at those things too. So
I think a tricky part regarding enforcement, especially with masks, is for people who might have conditions that you can't see just by looking at them, and they might not be able to handle wearing a mask. That gets a little tricky. But yes, in a perfect world, I do think that enforcement of masks should happen, but it's just that it can get a little tricky in my opinion.
mm-hmm.
The thing I would add on masks is that we should really be encouraging personal responsibility, something that I think gets lost in society today, that we all play our part to help protect those around us and keep other people safe. And so by us wearing our mask, we are modeling behavior that shows that we are personally responsible, but it also helps to make that the social norm. So the more people see others wearing a mask, the more they think it is okay, and it's the socially acceptable thing to do. So those of us that wear a mask, we should keep it up, and just by our gentle reminders and presence that we're showing people the way to model their behavior.
Okay, I think we have time for one more question. So it's a visit with family and friends while wearing and practicing social distancing.
So certainly those are questions we get a lot at Public Health. And it's almost as if every single situation we're in these days. Every time we're around people, we're trying to basically assess the risk. And so certainly you can be around people that you live with within your home without a mask on. You know, within your own home, you know, masks should not be something that you need to wear unless you have somebody who's particularly vulnerable in your home. Once you get outside your home and around other people, extended family, we would recommend that people have socially distanced gatherings. So keeping group sizes small and spreading out, especially if you can meet outdoors, is better. And so it's all about minimizing the risk. We can never get rid of all of the risk that we face when we go out, but just trying to layer up on those tools. So those tools are social distancing, group sizes, masks, all of those things. We add up layers of protection for ourselves and those around us. And so when we go out and we're around other people, try and layer those things up as much as possible. And that's going to help limit the spread of the virus.
Okay, well, thank you, panelists, for all of your answers to those questions. Dr. Lacey, I'll go ahead and turn it back over to you.
Well, what about the door prizes? Don't you have some more?
Well, we didn't in the chat. So no, we just had Ann Downey. And so I went
No,
ahead.
I mean, did you ask any of the other questions for the door prize?
Well, no, because they're not no.
That last, you remember our grand door prize or anything?
Okay, yes. So I can ask that question. So what are the 3 W's you shouldn't leave home without?
Did our audience leave?
Okay, so I'm waiting to see if we have an answer from Facebook.
Okay.
As of right now, I don't know. We don't have any answers from Facebook. Okay. So I'll just go ahead and turn it back over to you.
Okay. Well, with no answers to that one, I think we should at least emphasize it. I don't know if they knew what we meant or whatever, but Fanta in particular emphasized that a couple of times about wash your hands. That's the first W, wash. Wait at a distance, commonly called social distancing. So wait at a distance from others, second W. And our third W is wear a mask, something that we're all really reminded of all the time. So that, and in the session, we didn't talk quite so much about some of the places that are becoming very familiar, not by name, but just the types of places that we have to be very cautious about. Factories, prisons, jails, and in our geographic area and across the country, it seems that bars are the #1 place that people go to socialize, and then up on socializing with their mask off, often that's the center for spread. So bars is something that we can voluntarily not do. But since you are a teenage and young adult audience, we know you don't have to worry about that now, and you can't really needle others too much about it, I guess, but just be aware. Rallies, protests, those are getting a lot of political attention, but we have to try to figure out the public health perspective on each of them, as you've heard here today. So it's been a wonderful session. We had presenters who would have been exemplary presenters anywhere on this topic. And we were fortunate to have them right here in Carbondale, Jackson County, Southern Illinois, Facebook. They were wonderful. So we thank each of them for what they did to help us make this the presentation we wanted it to be. And with that, we're going to sign off and say, once again, thank you, thank you, thank you.